This is a Pilates exercise which is designed to strengthen quite a few muscles actually. Predominantly the little muscle again here on the inside of your knee. Also the bum muscles on the side, so we call those the lateral glutes, or you might have heard them referred to as gluteus medius or glute med. The other thing it's going to strengthen is through the foot arch. So there's a few things going on. I'll try and break it down nice and easily for you. We call them skiers, which is a great way to remember it because it looks like the action you would do if you were on the ski slopes. You're going to come into a slight little hip fold, so your knees are bent and your hips are bent. Watching that you haven't got your bottom tucked under and your back rounded. Remember, you're flexing at the hips, nice straight back, little bend in your knees. Now your knees don't move throughout this action. I'm going to do this on my stronger side. It's nice with your hands on your hips so that you can feel for your hips twisting or moving or rotating. They want to stay nice and stable. You're going to slowly transfer the weight onto one leg. This is the leg that you're working on predominantly. And then we're going to tap the toe out to the side and return it to the center. What you're watching for is that this stance leg doesn't move at all. The hip, the knee and the foot all staying in nice alignment as you take the toe out, little tap to the side and return. You're also getting a little bit of work for the glute med muscle on this side. Its job is to take the leg away from the center of the body. So you're working through this side, but predominantly it's this stance leg that we're working on. Now what most people do if they are weak in some of these muscles is they'll collapse through the foot arch as they go to move. So you'll see that I'm rolling in on that stance leg. But look what that's done to my knee. It's also just drawn the knee into the inside, and I probably ended up twisting through the hips as well. So you might find hands on hips is a nice place to keep them so that you've got that feedback. You can also just slide your hand down to that glute med muscle, engage through your core a little bit more strongly. And as you transfer the weight and you think about stepping away the other leg, just watching that this is nicely engaging through the side, knee stays in alignment, tapping the toe out and drawing it back to the center. You can do as many reps as you've been recommended on this side, probably upwards of 12. Again, these muscles through your glutes are designed to work for a long period, so we do really want to increase the endurance of them. If you feel like you're wavering a little bit, pause, stop, regroup and go again. And you'll see I'm having to work a little bit harder on this other side. I just want to drop into my hip a little bit. I can feel I'm having to work a lot more hard through my foot here to maintain that balance. So you're going to perhaps do a few more repetitions on that weaker side. When you're ready, standing up, take a stretch. You should find that that will help both your glute muscles, the little muscles around your knee, and some strengthening through your feet.